I think this meeting is probably above all about pragmatic innovation, how to make innovation that really works to do the higher goals that we all want to do. I think this session has a particular value because of the experiences you're going to hear. So we have some very distinguished people, some very experienced people at implementing or driving the implementation of new approaches. But intriguingly, they've been asked to talk about things that didn't work in order that we can learn lessons from that.
I'll tell you about one example. One of the first things that we did along with a company called Neurosynaptics that IIT Madras had incubated, we had built a remote telemedicine kit. Now this was done because there are no doctors in the villages of India. So we thought that if we can go and put a remote telemedicine kit there and which can measure temperature, blood pressure, ECG, heartbeat, we will be able to make a difference. It looked all perfect. And of course it has to be very low cost because otherwise it will not work in India. Initially, there were urban doctors who were very, very enthusiastic that this is going to enable us to really work in the villages and we will really make a difference. But the enthusiasm wore off after 2 to 3 months and they were all very busy. And they sort of said, well, I don't have time today, and they kept on postponing. And we really sort of saw that we have not worked out the business model. We had not worked out how to deliver medicine. We then involved a pharmaceutical company to deliver medicine. And then the issue came that the people who were there in the front end very often did not put the equipment properly. We then tried to bring in trainers. All this increased the cost. We had initially made our kit very low cost, but overall the cost was not that small. And the business model was something that we were struggling. And we have struggled for 7 to 8 years. The only thing is that we have not given up. And recently with World Health Partners, it has been starting to succeed quite a bit. Still, the business is fragile, but it is working much better.
More importantly for me and for this discussion this morning is what I would call a spectrum rather than a dichotomy between failure and success. And in that spectrum, colleagues, I think I would say on the far end of the spectrum, there is, for us, failing to implement what we know works. And for me, that is failure of technology. When we're talking about technology failure, we're not talking about the soft technology, the hard technology, or the gadget failing. We are talking about failure of a system or failure of processes. In Africa especially, we have divorced healthcare from development largely. We speak, for example, when we talk about a control of diarrhea, we speak about all the other things that we have done in clinical trials that we know work. For example, we talk about zinc and ORS. For example, we talk about use of antibiotics, etc. But there is an elephant in the room. And the elephant in the room is about hygiene. It's about sewage systems. In making those investments in healthcare, we may not even know what is the cost of sewerage. Because if there are pipes, clean water supply, we'll know that we will probably eliminate diarrhea in that setting. So it's an elephant in the room. We've divorced it from our investments in healthcare. And I want to point us to that. And that's why some of the technologies in developing countries fail because of that dichotomy.
And in 2003, one of the major mining groups in our country, Anglo Gold, wanted to get someone to develop a malaria detecting device. They wanted to be able to have something that could detect the malaria parasite quite quickly in mine workers. And who did they ask? They asked Gervin Libbe. And within 2 months, Libbe claimed he had a prototype machine ready. It was known as the Malaria wristwatch that you could wear, and it would test you 4 times a day for malaria. Then in 2006, journalist, probably the only science journalist, the only peer science journalist in South Africa called Elsabe Brits, started to investigate this malaria wristwatch. Gervin Libbe claimed that a major university was involved in the research of it, and she called the university and found out that they were indeed not involved. And she spoke to malaria experts who explained that it was implausible and it was not based on good science. And as a result of this reporting, it played a major role in the directors of Libbe's company taking him to court and suing him, and as a result, he is now jailed. Why were scientists not more proactive? For instance, like in the HIV field in my country, scientists are very proactive. When our former health minister made wrong statements, they would speak up in the media and the media would report as a result of it. And I think the other lesson to learn is that Elizabeth Brits was a very rare breed in the developing world. She had contacts, which is a good thing. Journalists should learn to have contacts and knowledge. But that's a rare thing to find. So I think when you report on health technology, especially in a developing country, it's really important that there's a partnership, a very strong partnership between technologists and scientists and the media.
I want to start by asking you, what is man's most prized possession? Life, right? What's a poor man's most prized possession? It's the same thing. Life. Are we asked to talk about misadventures in innovation and about making technologies affordable and cures accessible to poor people? And I thought that I'm going to be talking about the elephant in the room, and that is the innovation that didn't happen. How did we fail in a world where you have billions of people wanting to protect their most prized possession, ready to go to any lengths? And I said, even poor people want to do that. And they exist by the billions. And we have failed to come up with a business model that is capable of creating a viable and sustainable industry, as we've done in the West, for poor people. We need to find a way of selling healthcare services to poor people that actually is financed by the poor people themselves, because at the end of the day, they're trying to protect their most prized possession.